Hello, everybody. Welcome to session 5 of the first day of Allied. Not sure if we have seen you yet today or not, but I'm glad you are here with Dr. Josh and me for our session today on patient communication. It's going to be great. Lots of great information for you. Let's start the way we started every session. If you want to open up your chat window at the bottom there using the chat button, we can have some conversations while we're talking today for the next 45 minutes to an hour. And if you want to start by clicking that chat button, and then it defaults to host and panelists in that little blue box. But if you flip it to everyone, then we can have more of a community style conversation where we're all talking together instead of just talking to us, which is less fun. Hi, Jacob. And if you want to add where you're from, what your role is, what discipline you are a part of, that's really great for us to get a little feel for who's here. And I'm glad that you're here to spend I guess some of you, it might be moving into evening. So hope you have a beverage. I have an iced coffee on the go today. Welcome, everybody. Welcome. For those of you that I have not met yet, I'm Allie. I am a clinic owner. I have a multidisciplinary practice here in Vancouver, physio, massage, chiro, midwives, counselors, acupuncture, a little bit of everything. And then I'm also co-founder of Jane. So I get to work with all of you on a daily basis, which is a really great privilege. Our mission at Jane is to help the helpers. I don't know if you were in our session this morning, but we went over a little bit of where that came from and why it's so integral to the work that we do. And one of the ways we like to help is this conference with Allied. We're hoping to bring really helpful information to you in these kind of bite-sized sessions, ideally with things that are really practical, really action-oriented, things that you can maybe take one or two things away from and just put into practice right away. So Josh is a friend of mine that we've known each other for a few years now. I feel like the whole COVID time has compressed, and so I don't count the last 2 years. So I guess it's maybe 3 or 4 years. Is that true?
I think so. Yeah.
And Josh suggested he's passionate about the patient practitioner communication and offered to run a session for Allied for everybody to share a little bit of his thinking on this and the way that he's woven, is that a word? Weaved that into his practice. Weaved, woven. I think
woven.
I feel like I should know this.
Woven. Weave,
Claire says woven that.
Yeah. All right. Thanks, Claire.
Yeah. I think we can have consensus on that. Okay. Hello, everybody. So I'm going to let you take it away, Josh, since you do more of a complete intro to yourself already.
Sounds good. All right. Well, thank you, Allie. I appreciate the opportunity here, and I'm excited to talk to everybody from literally around the world. This is awesome, and I appreciate you guys all spending some time. So I will share my slides here. And I have some slides here. Let me know in the chat. I just want to make sure. Allie, are you seeing those?
Yep. Yep.
Right. Fantastic. So thanks for joining me. I want to talk about turning trust into treatment. And all of what I'm going to talk about today is based in evidence. My team and I have downloaded probably at this point 50 to 60 different articles and journal research that talks about, unfortunately, the lack of great communication in healthcare. And the reason I want to talk about this is it doesn't just affect, so I'm a chiropractor by trade. It doesn't just affect chiropractors, it affects everyone in healthcare. And I wanted to, because Jane is so great at communication, I wanted to talk a little bit about what you can, some ways that you can improve communication, and then also some tools within Jane that will allow you to do that. So like I said, my name is Josh Satterlee. I'm based here in beautiful Las Vegas, and I label myself a recovering poor communicator. I've spent a lot of money learning how to be a better communicator. Part of that is that as an instructor for the Titleist Performance Institute, and part of that is being a business owner / husband that needed to communicate better. So my goal today is I want to teach you guys some tips to build trust through patient communication. So you're going to keep hearing me talk about building trust, because trust, the amount of trust built in the relationship, is really the measuring stick we're going to use. And I think that affects all healthcare. It doesn't matter if it's a midwife or chiropractor or surgeon. We want to have that patients want to have that trust with their providers. So here's a picture of me and my son in Puerto Rico, or I'm sorry, Puerto Vallarta. And, I think I've learned a lot about communication when you talk to kids. And when he was young, he would challenge me a lot because I realized I was not clear in what I was saying. And so he would do exactly what I asked him to do, which unfortunately was not exactly what I wanted. So today, my goals are, number one, I want to identify some overarching issues in healthcare communication. We're going to talk about why those things exist. We will discuss some different points where high quality communication can be most valuable. We'll identify what the patient perceptions and desires are within healthcare services. And then finally, I will have some slides to show you how best you can use Jane to help build trust. So again, trust is our measuring stick, and there are some tools within Jane that can really help us build trust. So we should use them because Allie and her team put together a great software. But I do think some things get overlooked in there that we don't realize how much the features can affect our patient communication. So since this is all about communication, let me be clear and clarify some things. I'm going to do my best to use the term provider today because I sometimes get referred to as a chiropractor, sometimes doctor, but I know that Jane services a lot of different healthcare providers. So when I say provider, I am also kind of using it as an umbrella for mental health professionals, doctors, therapists. So that could be occupational therapists, physical therapists, physiotherapist, as you say in Canada, massage therapist, or a marriage and family therapist, as we have here in the States. I would also say that's a nurse, trainer, whatever your role is. If you are the person that is providing the service, I'm just going to say that you are a provider. And also, I know that there are some people on here that run clinics, and every team member that engages with clients or patients can affect the trust levels that are built. So when I say patient, you might call them different. You might call them clients in your business. You might call them a parent, if that's applicable, a customer. But basically, this is anybody who is the person you are providing the service to. So I'm going to use those terms, but realize they can be interchanged throughout this presentation. So first off, in your clinic, I know Allie asked this, but I'm just interested, how do you label yourself? So maybe you wanted to say like for me in my clinic, I go by Dr. Josh. I'm pretty casual. Like I would say I'm very casual. I have been to other chiropractic clinics that I would say are more formal, but how do you label yourself in your clinic? And also, how do you label what we would term your customers or your patients? Type that into the chat. I want to make sure that you guys were able to use that. And I want to provide, as we go on here, I want this to be interactive. I know you're spending the last part of your day with us, but would love to get the interaction. Okay, clients, patients. Cool. So it looks like a lot of folks go by first name. Hey, Dakota, good to see you. All right, cool. So if I'm ever not clear about what language I'm using, feel free to ask. But it looks like, body talk practitioner. I like that. All right, fantastic. All right, so this all started, and I saw this quote, and I think it covers the problem very, very well, which is the single biggest problem in communication is the illusion that it has actually taken place. So many times we think we told our patient everything, and they heard almost nothing. So what is the issue that we face? If you look at the research, simply put, there is a huge disconnect between patients and providers. Unfortunately for us, and I think that we may need to be humble as providers, there are studies out there. There's one study I can think of that was done back in 1998 where they asked patients to rate the conversation between them and their provider. And on average, they rated it as 58% effective. When you ask the same providers that were in the room with those patients, ask them to rate it, the providers rated it 87% effective. And all of the issues, that 13% that was not affected, was because the patient supposedly wasn't listening. So what does that tell you? Our patients don't think we're as great at communication as we do. So what can we do about that? There is an inherent difference in the roles. The patients have significant goals, and sometimes there's confusion about what is the patient's objective and what is the provider's objective. And I want to help you clarify that as we go through this talk. But the way that we phrase it may be different. So there was a study done in a cancer clinic. And if you ask what was the provider objectives, was to clearly identify the tumor, take care of the tumor, provide treatment for the tumor, and eliminate it. So the talk from the providers would be, I want to provide the right chemotherapy schedule for this patient. I want to hit these markers in care. If you ask the patients what was their goal, none of that language was the same. The patients would say, I want to see my grandkids. I want to dance at my daughter's wedding. I want to be able to run again. It had nothing to do with the tumor. Although the patients knew they had a tumor, they were pretty clear on that. The language used by both parties was very different. And the goals that both parties have are very different as well. So it doesn't have to be a fight. Sometimes we as providers sometimes want to make sure that our approach is heard and our approach is confirmed. And the patients, unfortunately, at the same time want to be heard, and they want to be validated that what they're feeling, what they know, what they're worried about is okay to feel, and it's okay to go through. So as providers, we need to be asking, what is it that our patient wants? And it's our responsibility to bridge that gap or patch that gap up. So what is it that our patients want? So when is it important to communicate with your patient? And I want to use a framework that I think everybody can agree with, no matter what your professional license is or what your role is. So I look at it like this. Basically, in almost every patient case, there's an initial encounter, and then that leads to follow-up visits, and then that leads to some sort of discharge or delay. Delay would be like what you have with your dentist, where it's just a 6-month delay, but you never really get discharged. However, discharge, if you have a tonsillectomy, you would be totally discharged, right? You would hopefully never have to come back to get a follow-up procedure. So that's a very simple approach of where these different things, these different points of communication happen. So, but that's not all of them. I don't know if you've ever seen the movie Dude, Where's My Car? It's a great film, a great American film, and pulls up to a Chinese food drive-through, and they keep asking, and then. We need to ask that same question about our patients. When we encounter them, what happens? And then what happens again? And then what happens? So if we look at our map about when this occurs, we have our 3 major points here. And then we also have the step of when the appointment is scheduled. That's an opportunity to build trust. That's not often identified, but for patients, that's their first foray into saying, I trust you enough to schedule. But unfortunately, that's also an area where our trust is at the lowest amount, and it's our job as providers to build it up. After discharge or delay, there's also the post-discharge. So this might be nurturing. So in the case of any chronic disease, or if you provide lifestyle advice for people, it oftentimes happens after discharge, but you want to keep them informed about important factors in their health and also when to re-engage your services. So maybe if they hit a certain point, or for example, if you help through a weight loss clinic, when they gain back 10% of their weight, maybe that's a good time to re-engage your services or something like that. So there are these additional steps. There's also the delivery of diagnosis or other or important information. So there are follow-ups where we provide repeated treatment, but sometimes we need to deliver information, and those can be a little bit sticky at times. And then for many people, I know in the Jane community, a lot of people run marketing and workshops and education in their community as both a way just to serve and as a way to get new patients. So if you kind of look at it, patients kind of flow down this stairway, if you will. If you do marketing, that may generate appointments, and then people book their appointments. After they book their appointments, obviously they'll come in for an initial encounter after however long it is between that, 1 to 3 days. After the initial encounter, they'll do follow-up visits. Then you might deliver information at some point. Now that may happen multiple times. Then you would have a discharge event. And then finally, you want to follow up with those people and provide some post-discharge information. So that's kind of the different steps that communication, or different opportunities where communication occurs. Today, I'm going to show you some cool tools where Jane has some tricks you can do right there. Jane also has some tools to use in when the patient schedules their appointment, especially with online booking. And then also like some tools to use at discharge or at the end of care. So Allie, I did my best to match your beautiful color blue and the font, but
Pretty
forgive
good.
me if it's not perfect.
It looks different to everyone. I like what you're saying here about every one of these is an opportunity to both deliver information and build trust. And if you have those, like both of those intentionally in mind in your communication, it's not just information, it's trust as well. And so it's interesting that you're pairing those. I feel the same way at Jane. I'm constantly like anytime anyone emails us a support email, like this is an opportunity for us to build, we call it kind of build relationship, but you have an opportunity to, yes, answer this question that they're asking, but also put a deposit into the trust bank account that says, we're here to help you. We're here for you. We're supportive of you. So I'm loving, like, we're totally aligned on this and how we try to run Jane as well.
Fantastic.
So love it.
Yeah.
Thanks.
Interestingly, there was a study, I forgot the name of it, but it found that the highest patient satisfaction ever measured, above a 90%, was with providers that had basically, they had screwed up some way in the process and they had made amends. So it had gone down and then it came up. And when they realized that you were humble and provided that information, that was the highest rated, when the patient saw that you would be humble and communicate that I'm taking this on myself. This is my fault and we're going to work through it. So they said repairing communication is some of the most effective communication.
Totally. Yeah.
All right. So here's a question for you. I described this as the initial visit or that initial encounter, but what do you call it in your clinic? And did we overlook any identifiable stages in your practice? So I'm a chiropractor. I'm not a mental health professional, so I don't know that world at all. I don't have a multidisciplinary clinic like Allie, but was there any stage that you can clearly identify where communication always takes place that we didn't identify here? So if you have an event where you deliver a bunch of information or that you collect a lot of information, I would love to make sure we identify that. So throw that in the chat. And also, if you do workshops or education or that pre-appointment interaction with patients, I'd love to know about that. Type that into the chat. I would just love to see some answers here. Intake session, good. Ooh, phone consults, okay. That's a good one. Intake, initial consultation, all right. And do you do workshops or education in your community? Your patient exams, telehealth, okay. Yeah, I was making the assumption that telehealth fell under the same kind of outline there, but if that doesn't fit, we can modify that. Health history session, I like this. All right, yes to workshops, great. Non-COVID times workshops. We do a lot of workshops, by the way, and I know during COVID, it actually was logistically easier for us to cover a lot more people by doing it through Zoom. So newsletters, okay, I would put newsletters in the post-discharge nurture phase, but I like the fact that you're recognizing that there's a lot of information transfer there. Workshop, seminar, awesome. Okay, this is good. Sounds like you guys are providing great value to your community and whatnot. All right, so where are we as providers falling short? And as funny as it sounds, I recently read a business book, and the woman, her point was, a good question to clarify things is, how could this just be easy? Whatever we're doing, how could it be easy? And so to make this easy, why don't we just ask patients, And so when you ask patients, where are we falling short? A big area that comes up is patients believe that physicians can't understand what they feel. They can't understand their condition unless they first understand how they feel. And that's a direct quote out of this study, that patients report this. I don't think my doctor can understand what I'm feeling until he understands how it makes me feel or how it affects me. So we want to make sure that we understand the fact that these are human beings in front of us. So patients often feel that sharing their feelings and fears will be distracting or burdening to the doctor. So I don't know if you've ever had this experience. I have had it in my own life where I want to seem maybe tough, or I don't want to encumber the doctor. And when I look at it objectively later, I think that was the most ridiculous thing. Like, the doctor needs to know everything about me. And without that, she can't help me, without pure information. The interesting thing is, allowing patients to speak about feelings and concerns typically eliminates those issues, right? It typically lets them go. But if you don't allow your patients the time to do that, unfortunately, it's a barrier to communication. And so I'll share a story a little bit later where this occurred to me as a provider, and I'm a little bit ashamed of how things went, but it's important that we allow people to share their fears and feelings along the pathway to make an accurate diagnosis and accurate treatment. So here's some facts that I wanted to share with you guys. 90% of the time, patients are first seeking support for their emotional feelings and then for their physical symptoms. So think about this. I do a lot of musculoskeletal work. I treat golfers, mostly golfers. That's my little niche in my practice. They might be concerned with the fact that I can help their low back pain go away, but what they're most concerned about is the emotional ability to continue playing golf with their friends, to possibly beat their friends at golf, to return to golf. Very few times do they ever ask me about what anatomy is affected. All they want to know is, can I get back to the game of golf? They need that. And I don't know if that's ego or that's they want to be social, but the emotional aspect is what bothers them the most. And I think that's the case with almost every version of healthcare. If you think, I would guess with marriage and family counselors, the emotional thing is, the emotional issue is that your patient doesn't want to get a divorce. Right now, that you can deal with the other issues of how that will occur, but that's the core issue, is the emotion or the embarrassment or the concern about divorce. Another factor is 40 to 80% of the medical information received by patients is forgotten almost immediately. This study was done where they provided a bunch of information to diabetic patients, and they interviewed them 2 hours later. 2 hours, not 24 hours, 2 hours later. And 40% of the information had been forgotten. 24 hours later, 80% of the information had been forgotten. So it's important to offer tips and strategies for people, and remember that they have busy lives too. And when they leave your office, they have a bunch of things going on. How do you address that information loss? Another thing to realize is, don't fatigue your patients on that initial visit. You don't want to overwhelm them with information there. The research also pointed to a visit time of 20 minutes that would ensure that, and that's the initial visit where patients feel like they can effectively be involved in their treatment decisions. Now, that was actually cancer patients in a hospital, which 20 minutes in a hospital is a long time to be with an oncologist. But it took that long for the people to feel like the provider trust that they could trust the provider enough to effectively put together a treatment decision plan. Now, for chiropractors, 20 minutes, I think an initial exam is kind of standard. Maybe 30 minutes is more standard. So I think we're good there. I would guess in like counselors and mental health professionals that 20 minutes is very low for them. But I would love to know, how long does your initial visit last? That'd be interesting, Allie, if you guys could see what the average time of by profession, when we can choose our own appointment length. That's interesting. Yeah, it looks like, oh, wow.
At least an hour.
Yeah, hour, 90 to 2 hours. This is awesome. 45 minutes.
I'm listening to you talk about this like emotional need, Josh, and I'm going to tell you a patient story from like the patient perspective. At Jane, we have I think during this pandemic, people are even more like, I don't know when this survey was done, but I would say 100% of people are currently looking for emotional support. Yeah. I'm sure that's gone up during the pandemic. And we have a Jane Mamas channel. And I posted in there, I feel like I'm supporting everyone all the time, all my children, and no one's emotionally supporting me. And like literally every mom was just like, I just need to go to like, I need to go to a healthcare appointment just so I feel like someone's caring for me. So it's just like, it's just really raw, I think, right now for people. So I love that you're talking about that. And the initial visit is obviously a phenomenal time that you have to create that trust very rapidly with a brand new patient. So I like this. Yeah.
It looks like everybody luckily is it's awesome. Everybody's going to be exceeding that 20-minute mark. I don't know if this is mostly chiros and PTs and musculoskeletal providers. I would love to know, okay, occupational therapy, 1 hour to 90 minutes.
Yeah, we're even with chiro, we're seeing a pretty consistent hour initial visit for most disciplines, actually.
There was a question about citations where we got the research. I'd be happy to provide that. I don't know, Ali, if we could I could email you a list of the info and
whatever
you could distribute it or something like that.
You can add it in the email when we send around the recording.
Fantastic. All right. So 20 minutes is kind of the breakover point of where that trust gets built. Patients who felt they had good communication with the providers had 19% higher adherence to their care. So I see this question on Facebook all the time in the chiropractic groups I'm in. Hey, I have difficulty with my patients and their compliance, right? How compliant they are with their treatment plan. And what this study said is if you communicate well, 20% improvement basically in compliance. Will they follow through with those things? Now, you have to build trust along the way, but when you engage in good communication, there's a 20% adherence. I think that if you remove the patient-provider relationship with good communication, I think you would have 20% more sales if you were selling automobiles, or you would, if you go to any sort of family event, if you have good communication with the family member in front of you, it's probably going to last 20% longer, right? So I think it's not, again, we're just dealing with human beings. And that's what's so funny here is we forget that perspective. Only 7% of that emotional communication is conveyed verbally. So for those of you doing telehealth, I think that it's very important to think through your strategies on how you get that emotional communication of how they feel long before you ask what the problem is. So I think in an in-person visit, that can be shortened. And I wonder if in telehealth, it needs to be lengthened to allow for that. Because in telehealth, there you get the eye contact and the and verbal cues, but it's hard for the patients to convey that.
I think I was talking to Aaron LeBauer about that. He was saying that moving to telehealth actually increases the need to, you have to be more thoughtful about your verbal communication, because suddenly everything has to be done verbally.
Right. Yeah. So you're restricted to that.
Yeah. It can strengthen your communication skills when you move to telehealth, because you have to practice. I think Claire is saying 100% to that there's a bit of a shift required, but interesting.
Yeah. And then finally, physicians with high malpractice claims, which is a great area if you're ever looking to find out about communication. Malpractice research is usually done by large hospital chains because they're spending cajillions of dollars and they don't want to spend cajillions of dollars. But here's the interesting thing. High malpractice claims have 2 times as many complaints related to communication than providers who were good communicators. So another way to say that, if you're a good communicator, the research indicates that you can screw up and you can commit a malpractice of the medicine. So let's say you do the wrong surgery on the wrong hand, and there's a citation I can provide you of the wrong surgery on the wrong hand. If that surgeon communicates, explains what happened, is truly sorry, the chance at malpractice is very low. In fact, malpractice from the research very rarely has to do with the practice of what you do, but rather it has to do with how you communicated it. So if you want to get into some malpractice claims and have people sue you, don't be humble, don't communicate well, and make your patients feel deserted. That is the highest word that comes up when patients sue for malpractice, is that their doctor deserted them, which is interesting, right? Like our kids don't want to feel that way. Nobody wants to feel deserted in their care. So the good news is we have all done professional training. And so we're experts about the problem. We understand the anatomy, we understand the physiology, we understand those things, but what are our patients experts in? Think about that for a second. What is it that your patient is an expert in? So I think about a great contrast is, think about a male OBGYN provider, right? Literally doesn't have the same anatomy, but that doesn't mean that they can't be effective in that role. And in fact, there are some amazing male OBGYNs, but they don't have the same anatomy. So they can't be an expert in that. But so getting the information from our patients is often important, but what are the patients experts in? Another study was about, we'll talk later about validation, how important it is to validate your patients. But another study was about patients with autoimmune diseases. The average time it took to receive the autoimmune diagnosis, any guesses for how long it was? Allie, just because you're on my screen, how long do you think from the time the patient first reported symptoms to the time they were accurately diagnosed?
I know it's gonna be a long time. Autoimmune is one of those ones that's super tricky to diagnose.
Just take a stab.
I'm gonna say, I'm gonna say 3 years.
You're close. That would actually be the timeline of when they first get the diagnosis of having a mental disease. But 7 years is the average. The high point was 11.8 years. That person is telling you they have symptoms for 11.8 years, and it's being denied by their providers. So it's kind of crazy, but they're experts in the way they feel. Like Allie, for example, you know how your body feels when you wake up, and when things don't feel right, you are the only expert in the world about how you specifically feel. And it's okay to tell that person, I believe you. Your pain is real. Your symptoms are real. Your body's changes are real. All right. Secondly, trying to understand the whole person. We are treating people, not pathology. I don't know if anybody in this chat has ever worked with like a runner, for example. I learned a lot from working with runners and triathletes that their driving force is to return to running. So they don't care necessarily about what the makeup and the healing times and the timelines of ligaments and tendons and muscles are. What they care about is returning to running. So anything regarding treatment, diagnosis, risks, informed consent should be shaped in their language, which is running. They are a whole body that wants to run. I missed one. Third thing, it's important that we talk to our patient about what's going on in plain English. We are bilingual, and this is another word that comes out of the research. We are bilingual. We have our medical language that we learned in school, and then we have our plain language. And think about, so many times we trip up and we dive into the medical language or medical description of the disease, the pathway, the test, the various aspects of it, when really our patient is looking for that plain language. So, for example, an at-home pregnancy test. Obviously, they sell because they're an at-home pregnancy test. It's very clear. But what it's actually testing for is not pregnancy. It's the presence of a certain hormone above a certain amount. Now, if on the label it said, progesterone testing kit - home version, how many of those would get sold, right? It's so funny that, but in our clinics, we default into that medical language. So is there any medical language that you sometimes trip up and use in your clinic when you realize that another explanation might be better? For example, I'm a chiropractor, and people often ask about they will hear that, oh, I have a disc bulge or herniation. And as inaccurate as it is, I often use an analogy of a jelly donut, not because that clearly defines the anatomy, but because more than any other analogy I've ever used, my patient understands it. And as much as we say in medicine, in chiropractic Facebook groups, people be angry about the jelly donut analogy. And it's it doesn't matter if we're angry about it. What matters is if our patient understands it. Yeah, knots versus lesions. I like it. Anterior, posterior, lateral. Dakota, very good job. Yeah, people don't know what medial or lateral means. Eva, you do bring up a good point. What if they understand it incorrectly? Yeah. So just because we're on a short timeline here, I'm saying that we should describe these things in plain language. We should be careful not to incorrectly describe them. But I hope what you'll leave with today is it's important to figure out the language you want to use with your patient. How many words your child says? Raw meat analogy. These are good. Feeling depressed or having depression, inside of leg versus outside. Yeah. Angry spots. I like some of these descriptive words we're seeing in the chat. These are good. And, it is a delicate balance to make sure that our patients understand, man, sorry about that, that our patients understand what's going on. We obviously don't want to describe it incorrectly, but it's more important that they understand the premise of it rather than the exact structure or the exact name of the anatomy. All right. We also want to find or seek common ground and partnership with our patients. They should be an active participant in this. So it needs to be partly our role and partly theirs. This is really important if you're talking about or worried about compliance. Like how much autonomy are you allowing your patients to have? And how much autonomy are they willing to use in their own care? So, excuse me, when we discuss about treatment options, it's important to discuss possibly like what role will they play? And oftentimes that's not clearly defined. Then finally, excuse me, we want to strive for that enhanced patient relationship. It's one of the most complex social encounters. They want to come to us because we are experts in understanding their condition, but they don't want to feel like we are the hero in the room. As our friend John Morrison would say, we need to clearly play the guide for those people. So it's a difficult dance that you have to do because you need to be able to put your foot down sometimes and say, this is the best treatment, but you also need to involve them in the process as well. So question for you, what percent of your patient conversations go great? And have you ever had the experience to find out late in the patient relationship that there was very impactful information? So 2 questions for you. What percent go great? And have you ever received important information, like there's a presence of a red flag late in the relationship? 60%. Yes, always at the end. Yeah, I'm glad. I had a patient that a good friend who didn't share, and I asked him about, I didn't recognize his red flags, and he was not forthcoming with his red flags. And unfortunately, I treated him for low back pain, and it turns out it was colon cancer. And that definitely shaped my thoughts about communication here. It's difficult, and that's what tipped me off of the fact that we need to actively build trust with our patients. Yeah. Trauma and reverse childhood events. This is interesting. Yes, this is great. Okay. I think that 60% of our patient conversations go great. Okay. I appreciate you guys. In MX, people think things don't apply. What's MX? Is that mental health? Claire, I don't know what MX is.
Massage.
Oh, massage. Okay, cool.
I would say that's true for probably most manual therapy, though. People come in and say, I'm going to tell you about my shoulder pain, not necessarily about my mental state or my past. They just think you just need to know about my shoulder pain.
Yeah.
So
it's like in low back pain, like some of the red flag questions are like, do you have any, incontinence, like urinary incontinence? And I mean, here's why I'm talking about this stuff. So the patient's sitting in there, they've never met you. And they're going to walk into your office. And within the first 5 minutes is when we ask our red flag questions typically. And it's like, you're expecting this person, this human being in front of you, to admit that they just peed their pants when they stood up in your waiting room. Like in any other situation, that would be a ridiculous thought that they would have that much trust level with you, right? And so if you're going to ask red flag questions, I think like put them as late into the trust building exercise as we can. So in an initial exam, red flag questions should come at the end instead of at the beginning, simply from a measure of trust. Because here's the problem. If we don't have trust and they deny those things, they say, no, I don't have any urinary incontinence. We just created a false negative in our diagnostic process. We are now dismissing it, and false negatives are what kill people. So be careful with that. Put them as late as you can. Yeah. I'm seeing a lot of great discussion. This is awesome. I think that we have some really good, really smart people here, because I love the humility too, because some people are saying like, I aim for 100%, but I'm only at 60% right now. Well, here's the good news, guys. In meta-analysis, it concluded that training providers an effective communication strategy has significant benefit. So what does that mean? Great communicators in healthcare are made, not born. Okay. So however good you are right now, if you say, like me, I would not describe myself as a great communicator. The good news is we can hack the system. We can provide some training. And the other thing is Jane already has tools within it that will help you build trust with your patients. So it will set you off on the right foot. Now, I'll say the other side of that is if you don't actively try and build that trust through the messages that are getting sent out on your behalf, and Jane is sending out messages on your behalf, you might not be building the trust levels to the level that would be very important for your healthcare. So let's talk about what we discovered. We ended up putting together this, what we call the patch framework, based on if we clump all of the research together, we found 5 major themes. And the first one is, number one, you want to be clear on your patient's goals, not the goals of treatment, your patient's goals. Why are they in your office? Second one, you want to encourage autonomy. That means the patient can give you information, they can they can be part of the decision-making process, and it's important that they're also doing their own work. Number 3, you want to tailor the intake and delivery of information. So most likely, if there's a language barrier, that's important, but it's also important to look at that in how we phrase things and whatnot. You also want to focus on communication basics, making sure you're using appropriate eye contact, body language, tone, verbiage, aspects like that. And then finally, it's important that you express humility and modesty within your encounter. Again, we want to be the guide, not the hero in the room. So the most likely situation, those hospital malpractice claims, was a cocky surgeon who had multiple malpractice claims, was abrupt and short and dismissed patients. And the interesting was, if you talk to their staff, typically they're carry that same theme through with their nursing staff as well. So let's talk about patient goals. It's important that we drive towards patient satisfaction, and we're clear on what really matters. So I'll go back to that runner. What really matters to a runner is returning to running. We want to also look at autonomy. That could be phrased as adherence or compliance. And a good tool to use here is what's called the teach back, which we might get to later. When we're tailoring communication, it's important we do that at intake and delivery. You don't want to create a interrogation of just questions and answers. It wants the best information revealed in conversation rather than interrogation. When it comes to communication basics, there are verbal cues, there are nonverbal cues. We want to make sure we're focusing on both of them. So sometimes just sitting being comfortable with the silence is important to allow, and which is a nonverbal cue for them to reveal more information. It's difficult. I'm sure many people have heard that study where the average time it took for a doctor to interrupt their patient initial visit was 17 seconds. As soon as a person starts talking about their back pain, the doctor just can't take it anymore and goes, was it dull? Was it achy? Would you describe it as zinging? How, blah, blah. And now you've killed a conversation, right? It should not be an interrogation. And then finally, express some humility. It helps you avoid malpractice. And if we have time, we'll talk about the 4-part apology framework later. Looks like I'm going a little long here, Allie. I apologize, but let's go through this. And the goal of when we put together this framework of the patch was an implementable framework of communication goals for all healthcare practitioners that works not when you're at your best, because as we all know, there are days when you're just worn out, you're tired, your new patient who's scheduled at the end of the day is late. You want to get to your friend's birthday party at the bowling alley because you've been working all week. And so we want to put together a framework that works on your worst day and doesn't require empathy. Now, I'm sure there are people who are typing madly in the chat saying, you cannot talk about patient communication without encouraging empathy. Yes. After looking at the research, I think we can always have the goal of empathy. But if you don't have empathy that day, what we want to do is build so much trust that you still get accurate information, that your patient still leaves feeling that they were heard. If you then take empathy on top of that, we're in an excellent place. So on your worst day, we don't want you to require empathy because empathy is difficult to train. It's difficult to implement. And we want to use, the goal of this is to use communication to enhance your outcomes and increase trust to ensure compliance and also reduce no-shows. No-shows are typically from a lack of, any guesses? Any guesses? Allie, you want to take it? Trust. right? Why else would this person not show up? If they trust that you are the provider that understands them, can treat them and diagnose them accurately, treat them effectively, and they trust everything about what you've said so far, why else wouldn't they show up? No-shows are typically not a price issue. A lot of people think they are a price or insurance issue. The research points to the fact that they typically happen from trust. People self-select out of care due to a lack of trust. And once again, empathy is just a hard concept for a lot of people to learn. Now, empathy may be the expression of trust. I'm kind of diving into that, but our goal is to put together these options to build trust on the worst day you have, so that on the best day, you're awesome. So we got to put this together. And since you're all Jane users and that's why you're here, let's talk about where Jane falls into that line, how we can use Jane to build trust. So, oops, I'm going to go back here. I'm going to start at the bottom of this because this is the easiest to see and do in Jane, and then we'll work up to the top. All right. So down at the discharge or delay option, it's important that so there's this part of Jane that I don't even know if most people know about. On the left side, it's described as language. It's under settings, hit there first, hit settings first, and then second, go over here to language on the left side. Now, I think, Allie, if I can offer one suggestion, this should be labeled the patient experience tab instead of language, all right? Because this is what your patient, oftentimes their first experience will be with you is through the words that are in this tab. So I would highly recommend everybody goes in there and looks at it. And a basic rule of thumb, I think you need to flip it over, go to the bottom first and work your way up, and it'll make a lot more sense, okay? So if you look down here, the last two are your Google review, positive review prompt and negative review prompt. I think it's important to cover those first, and that's at the end of care, right? So this is the negative review prompt. So if something did not go well in care, you're asking for a review, and what you want to have here is allowing that person to be honest with you, and also think about it as a human. I'm sure we've all had bad service in our life, and I'm not saying that anybody on this session is providing bad service, but look, we all screw up. Sometimes it's out of our control. I had a patient that got backed into in the parking lot and wrote us a scathing review after he had left my office. He got backed into and he said, "That place is horrible. I never go there again." It had nothing to do with what I did for him that day, but he just had energy about it. So the awesome part is in that language tab or patient experience tab, you can change the language here. So if you look at what I wrote here, this is a person who's not happy with my care. I'm going to say, "I'm so sorry to hear that. Please provide a phone number where we can reach out to you. So I want to find out what went wrong. Or feel free to leave your brutally honest feedback here." This stuff is never going to be seen by anybody outside of your clinic. So allow that person to be brutally honest. Tell them, don't hold back. I want to know about it, because you're validating the fact that you screwed up and that they are angry. And so I would say modify this language so that it provides them a free place to review you. Now, I would say, please, I beg you, call them, get them on the phone and be humble in your talk, but you want to have that emotional interaction of a phone call. All right. So where else can we do this? By the way, I would highly recommend modifying your positive Google stuff as well. But just for sake of time, let's jump to the follow-up visit. So once again, we're between the initial encounter and follow-up visit. Well, think about in Jane, how are people going to get to that follow-up visit? Some people book on their way out of your clinic. But what's another great feature of Jane is the ability to book online. So think about where they're coming from when they book online. They're coming in for a follow-up visit, and our focus is on symptom change and not emotional changes. Sometimes we haven't addressed the barriers that are coming up, and we focus too much on the ongoing treatment rather than collecting more information about the whole person. Holistic care is important here, right? So I'm in a loop. Oh, there you go. So what do we want to do? We want to tailor our language. We want to use communication basics at every one of those to collect more information. And we want to be humble in our approach. So if we look at this, that is the T, C, and H of the patch. We want to make sure we apply those basics. So how do you do that in Jane? If you go to that language tab and you go to this SMS appointment, thank you for booking. This is the message that they receive via text message when they book. Now, I will just tell you, I would not rely on emails to communicate with your patients. I don't know about you guys, but I get hundreds of emails a day. I don't open many of them. I reply to even less. I would say it's probably 5% open rate, 1% reply rate. SMS currently has over 90% open rate and over 90% reply rate. So if it's important, this is the best way to communicate with your patients. And lucky for you, Jane does it. Unfortunately, it just goes one way, but at least we can get into their inbox. So we can modify this language too and say, hey, first name. So I want to use their name. That's a basic piece of communication. We're excited to see you at your appointment on this day. Bring your burning questions. I'm offering an opportunity for them to provide some information to me. I want to make sure that we're looking at that information to say, like, it's okay for you to bring your burning questions. I want to, now the issue here is I want to be tailored and humble here, but the text message is also reduced to that 130 character max. So consider the length of your name. So see that first name little merge field there? If you have a lot of patients with names like Alexandra, Mohammed, Cassandra, these are longer names. And for whatever reason, as I said, I work with golfers. They're all named Bill or Matt or Mike. I get extra letters because I see a lot of people with short names. But if you want to communicate with them, get into that SMS inbox and modify the language to say it's okay to bring up your burning questions, or what changes have you noticed, or some language that does that. All right, I know we're short on time here, but finally, one of the biggest areas you can build trust with Jane is when they first book an appointment. So think about where that person is coming from as a human being. They have never seen your office. They have never been there. Trust is at its lowest. No meaningful rapport has been established. They can feel like a number, and they are reluctant to share information that's important, like red flags. So what can you do there? These are the issues. And what would we say here as a solution? Number one, talk like a human, validate their expertise in their own body, and work to build trust. So how do you do that within Jane? Well, if you go over here to the intake forms button on the left side, and you have your intake form. So first click intake forms. And then for me, I just have the single intake form here in my account. So you might have a bunch of them. But the great news is you click that little blue intake form, and you'll see that you have an ability to write an introduction. Think about this on how you want to approach it. Whatever you write in this box comes out here. So we can say, like, please take a moment to fill out this form, but we're treating that person as a number there rather than as a human being. So we can change that. And I don't know if there's a character limit. I don't think there is a character limit, but we can do this. And so I wrote this. We feel strongly about helping you with your healthcare, and we believe you're the #1 expert in the world about your body and your feelings. Your pain is real. Your symptoms are real. So if it's okay, we're going to ask a lot of questions to understand your condition. Feel free to correct us. I'm trying to be humble there if we misstate details, and we appreciate your blatant honesty. Please don't hold back. I want to say that at the beginning of them filling out all their forms. So if there's ever a time they may have there's an offsite chance that they may have had numbness in their genitals when they had low back pain, I want them to be completely honest with that, not just burning over it because they're just trying to fill out my information. Now think about, you don't get the luxury of interacting with this person before they fill out these forms, right? Hopefully they were referred by somebody. Maybe they looked at your Google reviews online, but they're coming into this relationship cold. So this information is the only chance we have to set the stage here. And I would say tip of the cap to Allie and the team at Jane for making sure that this can be modifiable, because what I asked for in chiropractic is very different than what I asked for, I would guess, that people ask for in mental health. But it's so important to set this stage. So again, this is all modifiable language that we want to make sure we change because it's our opportunity to communicate with our patients. So I don't know if we have time here. Ooh, we are tight. So I would just say, is there any language you want to add to your intake that you think will open up what people talk about? Yep, it's great. Yeah, Jane is amazing at letting you change the stuff. A lot of other systems are just restricted in what you can see. So is there some language where you want to add it, or is there a term that you find that really opens up your patience? I'd love to know that. But just for the sake of time, I'm going to move past that. We'll talk about it at the end. But remember, it's important to focus on our patient's goals. Number two, create and actively encourage patient autonomy. What role will they play and what decision-making can they help with? Tailor your information intake. We have to focus on communication basics like body language, tone, what is called the healthscape. I love that term, like how your room is set up, what the pictures look like. And then finally, express humility. Obviously, I could go on for multiple hours about this. I think it's such an amazing subject. But here's one thing that we can think about when things don't go wrong. We can use the patch framework as a checklist. So I've had this experience, and Allie, I don't know if you've had this experience where you just leave an appointment and you're like, that didn't go great. I just can't put my finger on it. It didn't go great. So we can ask ourselves these questions. Am I clear on the patient's goal? Did I clarify how treatment will affect those goals? What role did the patient agree to perform? I didn't get to talk about a teach back. Did I tailor the information and address any language, religious, or lifestyle barriers? Did I use their name? Blah, 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 blah. Just for sake of time, I think we can audit ourselves when things don't go right. So I'm going to skip that question. So to review, communication matters. Jane can help. And the great news is we can train ourselves in this, just like we train ourselves in diagnosis and treatment to get the best outcomes. So I hope we met our objectives. And now, thanks to Jane, there's my son. What questions do we have? Do we have time for questions, Allie? I'm sorry.
Yeah, do it. You got 4 minutes.
All right.
That was great. I think people were really enjoying the information, I think a lot of people came away with at least a couple of actionable items, and maybe we can share some of that, the language around that framework, maybe that checklist, when we send out the recording of the session, so people have something to refer
Sounds great.
to. Yeah, amazing. I think I really enjoyed seeing people speak up in the chat there. It felt very like a community session, which was really lovely. You added a lot, since I hadn't seen any slides where you showed Jane off. So now I'm kind of like, oh, that was nice. You just really made some power users out there. Yeah, definitely.
Yeah, it's great that language can be modified. It's just, and I really think if you got a group of mental health professionals in a room, that language is probably very different, and you'll find that there are terms that get people to open up more than.
And I love what you're saying there about really specifying it to you. Like, you are a human, and then they get to know your personality a little bit before they even step into your office. And
that's a good point too.
Yeah,
I'm pretty casual with my patients on a first name basis, but there's a lot of providers I know are much more formal, and that formality, I don't want to. I'm dealing with mostly golfers, so they're not coming when they're
an informal bunch.
Yeah, and they're not in significant, debilitating pain when they come in. So you don't want to send an SMS reminder about like, we're excited about your next.
Totally.
If somebody's at the worst point in their life, it almost sounds disingenuous.
Yeah, totally. That's what I mean about, I love what you've shown here, and then people can kind of filter that through their own personal practice and their own personality, and just make sure that they're showing that through the words that they choose and the way that they present themselves. Definitely go through that languages tab. I like what you're saying about patient experience. We have to keep the word language, or people get confused about where it went, but patient language could be good. It's definitely all about
patient-facing language.
Patient-facing language. Yeah. Really good. I like that a lot. And going through and customizing everything that you can to give your account and the way that you communicate with your patients, that real, like, a kind of glimpse into who you are even before they arrive, is such a good. Good.
And one thing I'd love to put on the roadmap is, and it's, so this is just within Jane, but if you could send a picture and whatnot, and for those of you that are still on, if you send a picture, so if you're sending emails as well, and you can attach a picture somehow, or if you use MailChimp or something, a picture, if you're going to do that, share multiple pictures, especially of you in your own life. So if you have dogs, or you're a skier or whatever, share as many different versions of pictures of yourself as you can. And that has been proven to build more trust.
Totally. The flip side, you're a human.
Don't keep using the same headshot over and over and over and over and over.
Yeah.
Which is why I love that it's pictures in the services. When the patient is online selecting their provider, it's a picture of that person. Yeah. I love it.
Yeah, cool. Thank you so much, everybody. 4:00. We're right on time. Josh had so much information to share. He cut out half of his talk because he had so much to share. So we could probably do a follow-up session, or we'll include maybe some of the speaker notes. We can include that when we send out the video.
Sure.
So maybe people can review that on their own. Lovely to see you. Thanks for attending the first day of Allied with us. And hopefully we'll see you for some more sessions during the rest of the week. And thanks again, Josh, for sharing. That was
My
great.
pleasure. All right, Allie, have a great day.
Yeah, you too. Bye, everybody.